Researchers at the CSIR are developing novel approaches like wastewater and environmental surveillance to enhance South Africa's ability to monitor and manage the risks associated with infectious diseases. These cost-effective tools can also act as an early warning system to detect threats associated with emerging and re-emerging diseases.
The CSIR started with developing the wastewater surveillance approach based on the COVID-19 pandemic, when we realized, along with other researchers worldwide globally, that we need a better way to be able to monitor diseases, because the conventional way to monitor diseases was to look at individual patients. So you would, in a clinical setting, you would test people, which is obviously very costly and at a big inconvenience to people. But a way better approach would be if you could look at communities or towns as a whole and see how many people are sick. And that's where wastewater surveillance is such a good approach. Because if people are sick, if they are infected by, let's say, a bacteria or a virus, when they go to the toilet, they secrete those organisms into the sewage system. And there, we as scientists can go and we can take a raw sample at that centralized point where all the sewage flows to from a specific community. We can then analyze those samples for the presence and the levels of these bacteria and viruses. And once we understand how many there are, we can use that data by means of mathematical modeling to estimate how many people in a certain town or settlement are infected by that specific disease. Once we have the samples, we analyze it in an analytical facility to determine if those disease-causing organisms are present and at what level they are present. Once we have that, we also have the statisticians and the mathematical modelers that can then use and rework that data so that we can get an estimate of what's going on in the different communities. The CSIR is working with a number of stakeholders. We actually are working with other research councils like the Medical Research Council and with a number of universities that are also involved with the research, especially on the mathematical modeling and statistical modeling side of things.
We basically apply statistical and mathematical models to then translate the viral load into the number of cases that can be expected. In terms of the wastewater surveillance, it's very important that it provides us with information that we do not get, for instance, from recorded or reported cases. So wastewater would give us an estimate of the infections in the community, and that includes people that are not showing symptoms, as well as people that are never tested, because reported cases focus on the people that have been tested. So to get an overall view of the infections in the community, then the wastewater provides us with that opportunity to do that. When you say mathematical modeling, it means you are doing a deterministic way of estimating. But with statistics, we've got a lot of variability that we allow for. So we've applied both those methods to try and do the estimates. But the most important thing is for us to develop this early warning system so that we can be prepared for instances where cases increase, that is in the future now.
Wastewater surveillance techniques were initially developed in response to the COVID-19 pandemic, but over time it has become evident that these techniques can be applied to other infectious diseases, such as cholera, typhoid, and infections caused by protozoan parasites. We specifically want to focus on typhoid, cholera, and diseases caused by protozoan parasites because they are very significant gastrointestinal diseases in the South African context, and they are linked to water safety and sanitation infrastructure. Where expanding this wastewater surveillance can really benefit communities is that it will cause a shift in the public health response from reactive treatment to proactive detection. And this is especially true for vulnerable communities that do not have access or have limited access to healthcare.
Well, our CEPIMOD collaboration is a spatial epidemiological research group that started in 2020 in response to COVID modelling that was needed, specifically spatial modelling across the country. We have collaborations at CSIR. We started with a statistician there, Professor Pravesh Deba, and since then have also expanded into the wastewater team at CSIR. So the importance of spatial modelling and disease modelling cannot be understated. Diseases spread spatially, and we have a large team of specifically spatial statisticians that are part of the team, but we don't have the biological expertise. So our microbiologists at CSR were really essential to have as part of our team. And I think in our South African context, it's always a data scarce situation, a complex data situation. So we develop a lot of new techniques in that regard with our other collaborations. So wastewater modelling is particularly important because it's non-invasive. We don't need to get actual clinical data from people, so it's non-personal. And in addition, it's a mechanism to get pre-warning of diseases that might be coming up in a population before they hit and become quite serious. So I think what we're really trying to do is trying to get a pre-emergency model in place for the whole of South Africa with our collaboration at CSR.